Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Today's presenter is Dr. Jason Chu. Dr. Chu is a pulmonologist with the Washington Township Medical Foundation.
Thank you all for coming here. It looks like the weather's warming up, so I guess there's a lot of things to discuss tonight, and one of which is a very hot topic, pardon the pun, but the wildfires that we've had over the last several years that have really ravaged us in Northern California and throughout the state as well as the country. And the ramifications that it has far and wide as far as generalized health as well as and respiratory health. And you know, they have been very devastating with friends and family, and I'm sure people that you've known have been affected by these terrible, disasters. But I'm going to try to make it as general and as informative as I can for everyone from a teaching standpoint, as well as a kind of a awareness and a alert standpoint of what can be done and how to protect yourselves and how to be aware of things that resources that may be available to help. I know some of you here tonight in the audience, and I know that we are in an area that has very high risk because of the the droughts that we've had and the winds that we've had and just the last few years, as I said, the historical perspective. So I just want to go over briefly just some generalities in wildfires. They are, of course, unplanned, and they are burns that can occur in all those natural areas that we are abundant with, forests, grasslands, prairie. They cause a lot of devastation, like ruining homes, injuries, deaths, and they can happen anywhere at any time. PG&E has been taking ownership of some of that, and the risk increases with these droughts that we've had, this 4 or 5 year drought that we had. Thankfully, some of that has subsided with the rains that we had this past winter. And then the high winds, which has been very prevalent this spring. The causation, as you can see, are pretty much, pretty widespread. 90% of these wildfires are caused by humans, us, from unattended campfires. With the holiday season, there's a lot of campfire, like we just had Memorial Day, 4th of July is coming up. Discarded burning cigarettes, very common cause, and even intentional acts of arson. And then the other 10% causes from natural causes like lightning, where fires are usually started by an unusually long-lasting lightning bolt. And this is kind of like the trend, and there's another graph that I'll show you a little later, that the wildfires statistically are, quite high. Millions of acres being burned due to many, many, many wildfires. And the last 2 years have been extremely excessive. This is kind of like a 30, 40 years of how they have occurred throughout the amount of acres that have been burned as far as wildfires are concerned. So what are the aftermath of wildfires and the smoke? Well, as you can see here, wildfire smoke is a mixture of different types of gases and debris from burning buildings, trees, and other types of vegetations. And it can really make anyone sick and is harmful to many aspects of your organ systems, like your eyes, your respiratory system, your cardiac system. So it can worsen those that already have chronic heart or lung disease. In the lung category, it's mostly like the COPD and asthma patients and those that have pulmonary fibrosis. And who's at risk of getting sick or getting sicker more severely? Those are the older, elderly adults, pregnant mothers, children, young children especially, people with pre-existing respiratory conditions, and people with heart problems. And we always alert as physicians and healthcare practitioners to prepare our patients and have them as aware and as stocked up as possible. Like they say, if there's an earthquake that were to happen, or if something were to happen, what is in your emergency kit or your, things that you have to have nearby and access to. Well, you want to sign up for your community's warning systems, the EAS, Emergency Alert System. Know your community evacuation plan. Fortunately, I've never been involved in an evacuation, but I'm sure some of us have, and I've heard of stories of people that have. And you have to find several ways to leave the area, and it may be just mass pandemonium, so it may not be easy to get out of your certain area if you live in a really small cul-de-sac or, everyone is trying to go through a bottleneck area. It could be, very, very difficult and very dangerous. So know your shelter locations, because if your house is not equipped for, keeping you safe, you have to know where the shelter locations are. Gathering emergency supplies, including all your medications, whether it be cardiac or respiratory medications. And as you could see on the bottom there, these array of inhalers, and because you'll probably be needing it more so than if it were not for the situation. And then you need to designate a room that can be closed off from the outside air, that can, have, doors and windows all closed, but have some kind of, air conditioning system, because it's going to get hot. To best prepare yourself is to keep important documents in fireproof, safe place. I actually got one for Christmas one year, and I wasn't sure what it was for, but now I know. And so use fire-resistant materials to build, renovate, or make repairs, which most contractors and construction workers are doing now. And then find an outdoor water source with a hose that can reach any area of your property. And I remember some people that have done that, like up in the Orinda area when there were those fires, to really just hose down their shake roofs as wet as they can. Review all your insurance coverage to make sure it is enough to replace your property, and then pay attention to all the air quality alerts, because if you remember last November, the air was brown. It was like everyone was out having a barbecue, and you couldn't avoid it, you couldn't get away from it. I mean, it was so far reaching. So smoke inhalation injury, what is that? It's a very noxious type of injury. The smoke that occurs when you breathe are products of combustion, and they're all chemicals that are very volatile. And the smoke inhalation is the leading cause of death due to fires, not burns. It's actually inhalation deaths. So you asphyxiate. You basically can't breathe, and you die of suffocation, basically. It produces injury throughout the entire thermal injury to the upper airway, from the nose to the throat to the upper trachea. And these irritation or chemical injuries to the airways from soots, asphyxiation, and toxicity from carbon monoxide and other gases, including cyanide, which is a very lethal poison. And what happens when you breathe in the smoke? I mean, even if you have a healthy pair of lungs, no respiratory problems whatsoever, you can feel a lot of these symptoms, whether your heart starts beating faster, easier fatiguing, asthma attacks, headaches, chest pain, wheezing, shortness of breath, irritated sinuses, which was what I got last November, some scratchy throat, stinging of the eyes also occurred, coughing, and then the carbon monoxide poisoning, which could be deadly at a certain high enough level. The message, of course, is clear: to evacuate immediately if told to do so. And a lot of people don't want to leave their home, their possessions. They think they could, fend it off and, keep safe and keep their possessions, but definitely not to be foolhardy about that. If trapped, then call 911 and give your location. Listen to the EAS, the weather station, and the local alerting systems. I definitely forewarn all of us to get N95 masks now. Probably a lot of people have already purchased them from last year's, fires, and to keep harmful particles out of the air that you breathe. And I'll talk about that in a minute. If you are not ordered to evacuate, but it's smoky enough, stay inside in a safe location or go to a community that is safe, like a shelter, and that has less smoke. And don't be like foolhardy and not leave if told to do so. Call 911, listen for the emergency alerts, and seek medical attention if you are having breathing difficulties, because the visibility will be hard, as you could see in some of those roads, and there'll be a lot of people trafficking out of their locations. The best thing is to always be aware of how to protect yourself and your loved ones. Pay attention to all those air quality reports and what the air quality index is like. Whatever news bulletins or whatever systems are giving you these alerts, whether on your phone, or seeing it on television or listening to it on the radio when you're in your cars. Stay indoors if you are warned to do so, and keep your indoor air as clean as possible. Even though it may be warm, you should all have the windows closed shut, doors closed shut. Some people even put towels around where their doors are, wet towels. Turn on the air conditioner because usually fires occur in the hot months, like whether it be in the late summer when it's like 90 to 100 degrees. And turn on those air conditioners, but keep the fresh air intake closed and the filters clean as possible. And there are good filters that you can have, like the HEPA filters. So it really prevents a lot of that outdoor smoke from getting inside. And then if you don't have a good place, you have to seek a shelter where, if it's not your home, because it's too hot to stay in, that you have that place to go to. As I mentioned on the air filter part, use an indoor air filter that can remove particles to help protect the young children, as I was saying, or the elderly, or those with underlying medical conditions like a heart disease or asthma or COPD, because they really help a lot. And it not only helps for these, fire problems, but also, in areas that have a lot of pollution, like, if you live in a city and there's a lot of like freeways around where you are, or industry, those things can help it. Or if you have a lot of allergies to the environment, whether it be trees, grass, those HEPA filters are always very helpful for keeping those dust and particles outside and filtered out from hitting you indoors. And definitely don't worsen the situation by smoking, because there are smokers, and when they smoke inside, they're actually doing themselves a total disservice. So when smoke levels are high, do not use anything that burns, candles, fireplace, of course, cigarette smoking. Do not vacuum, because vacuuming stirs up particles. Definitely no smoking. Follow all advice given by your medical doctors on respiratory care management. If your symptoms worse, if you have this kind of action plan, what levels of inhalers or nebulizers that you should be using. And I'll talk a little about that later in this talk. And do not rely on any just garden variety dust masks that are being sold, because the paper masks commonly found in hardware stores will not protect your lungs from the smoke. They are basically useless. An N95 mask is the ones to get, and especially worn better. They fit better and they are much more protective. So avoid smoke exposure during outdoor recreation. In fact, avoid outdoor recreation, whether it's like playing tennis or jogging or biking. You got to keep that at zero. I mean, it's not the time to do that. Check your local news for possible wildfires before heading to any recreation area, like lots of parks and forests are commonly visited at this time of year. So these are the type of masks to not get and the type to get. So the ones that are crossed out here on your right are very flimsy and non-protective, and the ones that are much more highly recommended are the N95s, and then there's the P100s, which are a good respiratory mask system. And choose a particulate respirator that has been approved by the National Institute of Occupational Safety and Health, and they'll say that on the package. Do not choose a mask with only one strap or two straps, because they'll probably not fit or fall and protect very little of you as far as the mouth and the nose is concerned. So some cautions when using a respirator. Consult with your doctor before using a respirator if you have lung or heart problems. Sometimes they could be very obtrusive or even claustrophobic, and some people panic when they wear it. Wearing respirators can make it hard to breathe sometimes, especially the poor fitting ones. And if you have difficulty breathing and get dizzy or hyperventilate when you wear one of these, you should go to a place where it's as clean and as smoke-free as possible. And if you need to take breaks, take breaks often if you're doing anything physical, and keep hydrated. And sometimes the masks aren't for children because they obviously are not going to be as compliant wearing it, and then they may just pull at it or whatever. So it's not always the best idea for the children. Also very important is aftermath of a cleanup. Everyone wants to participate or help, or especially around your own home, but ash is just as harmful as the smoke itself. And I was made aware of this by kind of researching this talk, because obviously everyone wants to do their part. But you have to be careful when you do participate in any cleanup activity, because ash is made of larger and tiny particles, which are composed of dust, dirt, and soot. And those deposit on surfaces of the indoor and the outdoor surfaces, and it becomes airborne when you clean it up. So when you're sweeping or when you're mopping or when you're dusting, bam, all that ash is stirred up and you're inhaling all of it. And ash and other tiny debris after a fire may cause asthma attacks just like the smoke itself. So you got to protect yourself from these harmful ash when cleaning up after a wildfire. And how is the best way to do that? Avoid it if you can, but if you must, try to keep your hands washed and moist. Keep your eyes, away from contact. If you have to wear goggles, you should. And clean those areas as soon as possible after the cleanup part. Be extra careful around ash if you have a heart or lung disease, just like if you were in the smoke. And children and older adults should not even be nearby when cleaning up ashes occur. They should be in a different room, in a different location. And be as protective when you're doing the cleanup as you would as if you were trying to go from one place to another in the midst of the fire. So gloves are important, imperative. Long sleeve shirts and long pants. Shoes, socks, goggles, and the respirators that I mentioned earlier, the N95 and the P100 masks. Avoid the tracking of the ash off-site. So when you get from one site, which is the cleanup site, to a site that isn't the cleanup site, you should change your shoes and clothing before leaving that site. And you have to minimize any stirring up or sifting through the ash. The mist ash covered surfaces with water before mopping is helpful. Avoid kicking ash particles up into the air, and use a wet mop, damp mop, on any of the dusted areas. If the vacuuming is needed, use one that has a HEPA filter to clean the dusty surfaces. No leaf blowers, because that's just going to blow everything to the surrounding area. When the soot and the ash occurs, they can occur outdoors on your favorite fruit and vegetables where the ash has fallen, and you want to clean those off too with a moist towel. Store the ash in a plastic bag instead of taking a bag and dumping it into your garbage bin, which sometimes can be done, and it just doesn't stay contained then. So store an ash in a plastic bag or other container to prevent it from being stirred up, and can be disposed of in a regular trash bin. If you do experience any of the following, these are the medical attention that needs to be sought right away. Hoarseness in your voice, difficulty breathing, a prolonged coughing episode, mental confusion, which could be from carbon monoxide, wheezing, and these are all signs of smoke inhalation. Things that can be tested are chest x-rays. They may just show if you've got some inhalation injury. You could get an aspiration, like a pneumonia even. Pulse oximetry to check the oxygen level. It's a finger probe that a lot of people have that have lung disease or heart disease to monitor their oxygen requirements. Some are on oxygen, so they definitely use a pulse oximetry to check their levels. It's a small probe that is placed on your finger. It could be on your toe or your earlobes, and it should be in the low 90s, at least, if not in the mid 90s % range. There are blood tests that can be used to determine if you are anemic or if you are having low oxygen carrying blood cells. And if you have an infection because your immune system is lowered, you could have an elevated white blood cell count and a platelet count. So it's all in a CBC panel. There's also a carboxyhemoglobin level to see, or carbon monoxide level. If it's very, very dangerously high, you would need to be on 100% oxygen and maybe even a hyperbaric oxygen chamber. Chemistry panels that can be used to test, just a routine chemistry panel, a blood gas panel which can check the pH. And then, as I talked about, the carboxyhemoglobin and methemoglobin levels for severe respiratory distress patients, those that have altered mental status, fainting episodes, changes in blood pressure. Those are people that are probably going to need attention in the emergency room and possibly even be in the hospital or intensive care unit, depending on the severity of their medical problem. So the best treatment for smoke inhalation is just pure oxygen, usually by nasal cannula or by a face mask. That can actually, of course, help oxygenate your lungs and then your bloodstream. It may also minimize the negative effects of the smoke inhalation, like the inflammation, the constriction of your bronchial tubes. And if still inadequate or suboptimal, then higher amounts of oxygen needs to be administered, or even the point of intubation, because their airways become edematous. So the trachea and the bronchi narrow to the point where even if they're getting adequate oxygen from the nasal cannula route, it's not going into the lungs. So it has to be bypassing those edema areas that are swollen from the injury of the smoke inhalation. And an endotracheal tube and a ventilator is used for the patient to support their oxygen and carbon dioxide levels. And that's very critical, and then the patients are going to be in the intensive care unit, carefully monitored. They may even be sedated so they're not agitated and restless. They may be suctioned. They may need a bronchoscopy to clear up any, debris, residue, secretions. And I haven't had to perform one of these in a long time, but I'm usually one of the specialists that do bronchoscopies. It's a small scope that has a fiber optic light source, so you can see where the injury areas occur, and then you can actually, administer medications via the bronchoscope to maybe bronchodilate their lungs a little bit better and to retrieve any, debris that has fallen into their bronchial system. Sometimes they may be already intubated, so the endotracheal tube's already in their trachea, and you pass the bronchoscope through that. Then the follow-up for smoke inhalation, whether it be medications that are prescribed, if they need continuous inhalers, nebulizers, antibiotics, sometimes steroids like prednisone, because it may take time for the lungs to heal from the injury as well as the inflammation, and may leave some scarring, and should be monitored and followed up pretty regularly. I would say if they were hospitalized, probably within a few days, 3, 4, 5 days after discharge, and then maybe on a periodic basis for a couple of weeks to a month afterwards. And they may need to be referred to ENT, otolaryngology, if they have persistent hoarseness, if there's been some damage to the vocal cords, like polyps forming or excessive inflammation into the vocal cords that could be damaged. And they could be treated surgically or with, just speech therapy and time. And, that segues into a very common respiratory problem that can be smoke-related, fire-related, environmentally related, from ozone and from allergies and from infections. So as part of my respiratory health talk, I just want to touch a little bit upon asthma. This type of season in the spring and summer, asthma can be pretty prevalent. And then with the wildfires that are looming and that has been in the past, those can all irritate and damage the respiratory system, worsening chronic lung disease such as asthma. And asthma is not just an acute condition, it's more on the chronic side, but that can be managed. It's not just a one-time deal like let's say bronchitis or pneumonia. It can be, regular and part of a patient's health history. So what is asthma? So I know some of you have it in this audience, and it's a chronic disease of the airways that may cause wheezing, breathlessness, chest tightness, and nighttime or early morning coughing. And if someone monitors their peak flow, there's a lot of variability. So the asthma is not a stable, constant condition, that it can fluctuate. Episodes are usually associated with widespread but variable airflow obstruction. And the more variability it is, the more unstable or unhealthy it is, because it's not in a kind of controlled mode, if you will. And within the lung, that is often a reversible condition, either by itself, if it's mild, or with the right type of treatment. So here's just a little schematic cartoon about the differences between an asthmatic and a normal lung. So the one on your right is the one that has asthma, and it involves the inflammation and the constriction and the narrowing of the airways. So on the top is the person, and then on the bottom is a subsegment of the bronchial tubes, and you can see that the airway is much tighter with mucus plugging it. Like if you had a garden hose, there'd be like a lot of like either grass or mud in there. And the swelling is the smooth muscle that is like your bicep muscles that have just, expanded. And you don't want it to be that muscular, because the more muscular it is, the more tight it squeezes on the airway. And then the one on the left is a normal airway with smooth contours, wide dilated openings, and the muscle is kind of relaxed, and there's a large patent opening through that whole pipe, through that whole bronchial tube. So to diagnose asthma as a clinician is when a patient presents to you, they may have the chief complaint of I'm coughing, or I'm short of breath, or I'm wheezing. And when the physical exam is performed, there's, diffuse or generalized wheezing throughout like the different areas of the lung. And the thorax or the chest is expanded. So they're having a difficult time breathing, and a lot of it is exhaling. So they can breathe in, but their airways are so tight, it takes them, twice as long or twice as much effort to exhale all that air that they breathed in. So they're hyper expanded or increased. They call it barrel chested. So the lungs are so big that they are very uncomfortable, because that's not an optimal breathing condition to be in. It's almost like you're working out or exercising without doing it, because your lungs aren't efficient in getting gas exchange. So the airways are, narrowed, and then the nasal passages are with secretions and polyps. That could be from the allergy part. And then another part of asthma can be a skin condition, which is like eczema or atopic dermatitis. So it's like a triad. So if you have allergies, asthma, and eczema, you have this kind of autoimmune, related condition where certain little triggers that would not affect someone that is not autoimmune affected by it to be, having symptoms. So let's say someone has allergies and they go out and play in the yard, and they spend a lot of time and they inhale a lot of the pollen. Well, they're going to have nasal secretions. Their sinuses will get swollen. Their lungs may get congested. They may start wheezing, coughing. And if they, play in the grass or the bushes, they may get a little irritation on the skin and can have, like a dermatitis. So all those things, you can look for, ask for, like if you're talking to a patient, do you, manifest any of these symptoms, or have those symptoms been part of, what you've experienced in the last week or months or in the past? And if you do, then you're almost certain that when you do these extra special tests like these spirometries or pulmonary function tests, it's going to show up as being not normal. It's going to be like lower than your baseline. So there's going to be a baseline that's like 70% or 75%. And the patients that demonstrate asthma or have come to your office or to the emergency room or the urgent care clinic with these symptoms of wheezing, chest tightness, coughing, their pulmonary function test will be below 70%, pretty much guaranteed. And then if they are really symptomatic, they may not even be able to perform it and do the test adequately. But after a breathing treatment, they should have a clear-cut response of improvement, like 10%, 15%, 20%, depending on how reversible it is and how well they do their treatment. So if they do their treatment and 15 minutes later, the medical assistant or the respiratory therapist checks the results, it should demonstrate the reversibility, which makes it a more reversible condition than, let's say, like COPD or emphysema, which has more destruction and less responsive reversibility. And their post-bronchodilator or inhaler treatment test will be pretty similar as the one they did before the treatment. So then when you delineate their degree of asthma, that one, that they have asthma, two, how severe their asthma is, then you could have a therapeutic action plan and prescribe the proper medications and teach them, how to use it, teach them when to use it, and the types of medications available. I mean, to make it simple and to make it straightforward, there's really two major categories. That's the long-term controller, like the maintenance treatment. Like if people have asthma, they know the difference, like the Advairs or the Brios or the Symbicort, Dulera's. Those are more like long-term maintenance because they act and work for 12 to 24 hours. And they kind of maintain the bronchial tubes at a relatively patent, less inflamed, less constricted caliber. when you have an attack, like a wheezing attack, then those are not as beneficial. There's been some people that have not been told properly, and they use those as a quick reliever, and it could just stimulate the heart and not help the lungs because it's a stimulant, and they sometimes end up in the emergency room because they didn't get the relief, and they may even get some of the side effects from it. So when someone is on that maintenance drug, but they get a asthma flare-up, then they should use the quick reliever or the rescue medication like the albuterol that has like a 15-20 minute turnaround, whether it's by a inhaler with a spacer or with a nebulizer, and you get the deposition into your lungs quicker, you may be able to bypass a trip to the emergency room or to the urgent care, and then let your anxiety calm a little bit, and then let your symptoms abate a little bit, and then, hopefully then the asthma will subside in a timely fashion, and then you could maintain yourself, and then possibly make an appointment to see the doctor either later that day or the next day, and then try to think of ways that you can stay avoiding of those triggers and to maintain it in your own in your own home and your own resources that you have available, because I think asthma can still be 90% to 95%, maybe even more, maintained on a home or at work or at school basis with the proper understanding and action plan and how to act upon it. And then there's those that are few that are triggered by things that are out of their control, that they may have to render a more emergent visit to the ER or the urgent care. And schools are taught that now, whether it be the nurses at the schools or at the workplace, and then of course the patient or the families themselves. So medications to treat asthma, long-term controllers, taken on a daily basis, either every 12 or every 24 hours, over a long period of time, could be as their maintenance, used to reduce inflammation and relax airway muscles and improve symptoms and lung function. Those are the inhaled steroids like Asthma-Nex, Pulmicort, Flovent. The long-acting beta-2 agonists, the ones that have the 12-hour half-life, are like the product in Advair, which has salmeterol, which used to be Ceravent, and Formoterol. And they act as a bronchodilator, so they open up the bronchial tubes, but not as much as an anti-inflammatory as the inhaled corticosteroids. And then the leukotriene modifiers are a pathway that prevents edema or swelling, and that's like the Singulair, generic now, so it's called Montelukast. And the medications to treat asthma for a quick relief are these inhalers that you see. This one is Ventolin or albuterol. It's used for acute episodes, short acting. You can do those every 3 hours, every 4 hours, and hopefully as the condition improves, then you could expand those intervals. And it works quickly within 10-15 minutes, and it usually lasts about 3 to 4 hours. This slide here is just a demonstration of how to use these medications to treat the asthma. The healthcare provider, we have good MAs, and the respiratory therapists are excellent teachers and show the proper usage of these. And they should, after showing them, actually see them do it so that you can walk away knowing that they learned it and then they could do it, and then later on they could even teach it, whether it be to their child or to a friend, because that's the way it really ingrains in you. So take the cap off, of course, and then be in an upright position. Standing is better than sitting, definitely better than laying down. And put the inhaler in your mouth, or right about half an inch or so from it. And as you start to breathe in, so you exhale, and then as you start to breathe in, as deep as you can, that's when you actuate the device to compress it. Breathe in while you're pushing down on the top, and if you need to, a spacer will give you a more direct shot into the oral pharynx. And hold your breath for about 7 to 10 seconds, and then exhale slowly. For younger or older patients that can't coordinate this well enough, spacers are available to help that have difficulty. That can actually, studies have shown, have much greater lung deposition of the medication into the proper place that it should be. And those things are very, very easy and portable, so they can be brought with them as well as with their inhalers if they travel or even when they go to school or at work. Nebulizers are a little bit more effective, but not a lot more. But in the pediatric age group, it's probably more effective because they can actually get it directly into the lungs. But if you're using a spacer or using the metered dose inhaler properly, it's probably equivalent 1-to-1. It produces a gentle mist, but if used properly with spacers, probably equal as far as the efficacy. So to manage the asthma and asthma management goals, these are all the key points. Always try to achieve and maintain the control of the symptoms, because symptoms are what brings you into like distress or brings you to medical attention. If we can achieve and maintain control of those symptoms or keep them far and few in between, that is a very well worth goal to achieve. Maintain normal activity levels, because the last thing you want to do is have your child miss school, miss activities, recreation, because that's part of your wellness and your health and your overall well-being. Maintain pulmonary function as close to normal level as possible. That's where the spirometry and the pulmonary function tests come into play. Prevent asthma exacerbations, because each exacerbation worsens the overall general health of the asthma patient. Avoid adverse effects from the asthma medication, so you want to have a good plan, not overdo it or underdo it, because there's side effects from overdoing, and there's obviously the exacerbations if you underdo it. Prevent asthma mortality. Asthma is not a benign disease. It has caused very tragic, untimely deaths from respiratory failure in young patients, those that thought they were very well controlled. And I'm not saying sometimes the asthmatic patients that get into that kind of trouble are non-compliant. They are sometimes feeling so good that they don't realize that their asthma is even part of them. It's not like they're in denial, because sometimes people with any medical conditions wants to like downplay it and think that they're better than their condition is, and so they push the envelope. But it can occur to a person that knows what they have, and then all of a sudden, it's not because they didn't take their medication or forgot to take their medication. It's just that something was, inciting a very, acute event, and that either they're not in a place that they can get emergency care right away, like being intubated or being, put on a ventilator to rest their lungs and get them to recover. And it could be something that they didn't even know, like they may have been allergic to something that they weren't used to, and they had some of it, and it just, compounded a very serious problem. And I've been involved to help take care of a few of those patients that were not your usual severe asthmatics, and they ended up in the emergency room and then also down into the intensive care unit. So managing asthma, a good action plan, and I'll share with you what I consider a good action plan. You have to have that rapport with the physician, tailor it to meet the individual's specific needs, and good education to the patients and their entire family. If they're a child, whether it be their mom and dad, older sibling, schools like the nurses and their teachers, recognize symptoms, recognize warning signs, medications, how they benefit them and what the side effects are, and proper use of the inhalers, as I talked about, and then the peak expiratory flow meters. These flow meters are what the action plans will be constructed from, and they serve a very good purpose. It's like monitoring your blood pressure or your hemoglobin A1C level if you're a diabetic. So this is kind of small print, but it basically shares with you the red, yellow, and green zones. So if you're in the red zone on the bottom, you are in dire trouble as far as below your target. So let's say you have a peak flow meter, you use it on a regular basis, and on your optimal days you're at 500, easy number to remember. And then all of a sudden you feel a little tightness in your chest, or you feel like you're wheezing and you're labored and you're breathing, and you check it and it's 250. So that's half of what your normal is. And that's probably right between the yellow and the red zone. If you're like about 20% to 30% below, like around 350, you're probably in the yellow zone. So when you're in the red zone, probably use whatever quick reliever you have. See how you are in about 15, 20 minutes, but if you can't even get to that, call 911. If you're in the moderate or the yellow zone, definitely take notice of that. Curtail a little bit of your activities that you're accustomed to doing, whether it be outdoors and it's like a bad air quality day or whatever. You need to take a few extra treatments of your inhalers or your nebulizers, or make a appointment with your doctor in the very near future. That's a good action to take. And then if you're in your green zone, stay there as long as you can. Check it once a week or once every 2 weeks. It depends on how well you're feeling, and then just maintain. If you're on just bare minimum maintenance medicines, just use that like one balanced maintenance treatment a day. Some people were asking me, would that still benefit me if I've been like weeks to months on green zone? And I said, well, if you want to stay there and you know what your triggers are, it's okay, because the side effects are zero. I don't expect you to have any. You've not had any in all these times that you've been taking it. And I don't want to make that possible chance that if you were just to take it off for a few days and something didn't go well and you kind of go down a bad path, then I would feel like not giving him the best medical instructions. And it's like blood pressure medication. I mean, you certainly feel like, wait, my blood pressure is 110/70. Why do I have to still take my lisinopril or whatever? It's just because, it's kept it in such a good control. You've done your diet, your exercise, and everything else, low salt intake. But you don't want to just say, well, I'm going to get, the opportunity now to wean myself off these medications. A chronic condition is a chronic condition for a reason. Like whether it's in asthma, whether it could be genetic, or whether it's just, some childhood asthma can be outgrown, but sometimes it just takes a little, and it goes from mild or no effect to moderate to severe. And blood pressure issues are the same thing. That's why I prefaced this earlier by saying asthma is a chronic condition. It's not like a pneumonia or bronchitis where you take 10 days or 2 weeks of antibiotics and then you get a follow-up and it's good, and then you're done. You don't take the antibiotics again for that episode. So managing asthma, indications of a severe attack. All of you know that, when you're having an attack, you're going to be very breathless, very short-winded, even at rest. You have to hunch forward because you can't get enough air in. You speak in words rather than complete sentences. If that, you're more agitated, anxious, and your peak flow rates, like I said, are between less than 60 or 50% of your normal optimal level. Managing asthma, things people with asthma can do. So there's a lot of autonomy. We advocate for that the patients can really help a lot with themselves and have their own kind of individual management plan. And that's with their medications, understanding to avoid their triggers, and what to do when you do have an attack or a flare-up. And then as you educate yourself and know more, you can help others and share with them. We talked about the environment with wildfires, the smoke, pollution, air quality. So environmental interventions are important. Seek help from asthma resources. Join an asthma support group. We're very strong here at the Washington Healthcare Systems with Lucy and many others. There's lots of websites from allergy and asthma, to the CDC. And, I want to thank you for being such a good audience, but I want to welcome some time for questions.
I have several small questions. So the inhaled corticosteroid is the albuterol?
No, albuterol is the bronchodilator beta agonist. So it works on these cells, the beta receptor agonist, and it relaxes the muscles. Remember that picture that I showed of a very tight muscle, like in that tube? It relaxes that muscle, so it makes it softer and less constrictive. Whereas the inhaled corticosteroid decreases inflammation. So if you were to look with a camera like a bronchoscope, it would be very red, like if you had a strep throat. So the inhaled corticosteroid lowers the inflammation, doesn't bronchodilate or relax the smooth muscle from constricting, but decreases the inflammation, which are cellular components which bombard the airways, over and excessively. So you want to decrease it. That's what steroids do. That's what prednisone does.
Why the asthma have nighttime or early morning coughing?
Say that again, why? That's when the air is colder and you've probably had the longest duration of not using an anti-inflammatory or a bronchodilator. So a lot of exacerbations occur in the nighttime hours and also in the early morning awakening hours. And that's what peak flow variability means. So if your peak flow variability is off by 20%, 30% between your good morning, afternoon measurement, like it's 350, 450, and then at nighttime, after, whatever type of activities you've had that day, exposures you've had that day, and then, how many hours it's been since your last, inhaler treatment, and it's colder, you may have more constrictive effect, and then the next morning, again, it's colder, and you haven't had any use of treatment, it'll be your lowest times. If you have asthma, some of the things that the Asthma Academy and Association looks at is how many nighttime awakenings do you have where you have to use your rescuer, or there's something else. The amount of nighttime awakenings and the amount of frequent use of your inhalers is a trigger that you're in the yellow or red zone in your action plan.